Is the season to be jolly? United Health is undoubtedly the gift that keeps on giving. People keep sharing their stories, former employees, disgruntled patients, families of the disgruntled patients, videos leaking online. We see more and more resurfacing each and every day. Now, as we know, the former CEO of United Health Care was taken down. We cannot turn a blind eye to the main CEO of United Health Group, Andrew Whitty. There is a video that leaked online of Andrew Whitty addressing the company. And some may say in this video, the words that he used, he is essentially defending their denial practices. And this video then sparked more outrage online as the company continues to receive backlash for the way it evaluates their medical claims. This video was recorded the day after the fatal incident. Let's take a look.
I'm sure everybody has been disturbed by the amount of negative and, in many cases, vitriolic media and commentary that has been produced over the last few days, particularly in the social media environment.
But to also turn around and tell your employees next day, ignore all that you hear in the media. Ignore these outcries of disdain, not only for the company, but for the American health system. It's not making me or us look good. Not wanting to be exposed or called out or have or hold any accountability for their actions causes quite the concern, if you ask me.
And I want to reassure you of a few things. Firstly, we are going to continue to make sure that we put patients, consumers, and members first, as we always have done. The mission of this company is truly to make sure that we help the system improve by helping the experience for individuals get better and better.
United has the largest network of doctors, they are the largest claims processor, and they also deny the largest amount of claims. Now, between the physicians that they contract with and then their claims processor, who is the one mainly calling the shots to deny all of these claims for their patients and beneficiaries? Each year, doctors have the right to approve or deny a contract with a certain insurance carrier. Now, that comes from the terms and conditions that they stipulate in these contracts. This is why you may see your doctor being in network or leaving the network year in and year out.
There was nobody who did more to try and advance that mission than Brian Thompson. And there are very few people in the history of the US healthcare industry who had a bigger positive effect on American healthcare than Brian.
There are very few people in the US healthcare industry that had a positive effect on American healthcare than Brian.
And we are going to make sure that we not only acknowledge and honor that legacy of Brian, but we will continue it. Our role is a critical role, and we make sure that care is safe, appropriate, and is delivered when people need it.
They will make sure that care is safe, appropriate, and delivered when people need it. Who gets to decide when they need their care? People are requesting care and are getting denied for care. Prior authorizations, referrals, step therapy. These are safeguards that are put in place to delay access to care and coverage, to have the ability to deny something before it takes place, but then to also turn around and again defend their actions.
And we guard against the pressures that exist for unsafe care or for unnecessary care.
They guard against the pressures for unsafe care or unnecessary care. What exactly does that mean? And how are they defining what is necessary and what is unnecessary? Their denial rate of claims has gone up exponentially over the past couple of years. Are all of a sudden the things that you were covering before for people's healthcare needs no longer deemed reasonable or necessary for their health or survival?
to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
Safeguarding to keep the system that they have in place from becoming unsustainable. They don't want the system that they have in place to be disrupted. What they have going for them is a good thing. Subsequently and consequently, this is putting hundreds of thousands, if not millions of people at risk for their own safety and well-being. If they are under a health plan that poses the risk of not tending to their care? How would caring for the Americans that are in need become unsustainable for your business practices? Actually putting the funds that people are paying with their premiums, their co-payments, deductibles towards them, that takes away from the dollars that will be going into your pockets. Now,
so we're going to continue to make that case. We will continue to do the work we do. And I have never been more proud of this company and our colleagues and what this company does on behalf of people in need across the country.
I am not here to say all who work for United have ill intention, but you do have employees who are captive, who must take commands from the person who calls the shots.
I encourage you to tune out that critical noise that we're hearing right now.
Not only is Andrew Woody trying to save face, but he is also telling his employees that they need to ignore all that is being said on social media.
It does not reflect reality. It is simply a sign of an era in which we live. What we must do is focus on what we know to be true. And what we know to be true is that the health system needs a company like UnitedHealth Group, and it needs people like Brian within it.
The health system needs a company like UnitedHealth Group, and it needs people like Brian within it. And essentially, United is telling us that we should be happy that they are the largest insurer. I emphasized on Brian Thompson being the former CEO of UnitedHealth Care, but we still have the hierarchy of UnitedHealth Group, Andrew Whitty, still in place. There is this organizational chart from Organimi.com. At the top of it, you see Andrew Whitty. He is the head of United Health Group with three main people underneath him. Now, where does Brian Thompson fall? Going down to the bottom, second column, last row, CEO of United Health Care. Now, with him being under this umbrella, with so many other people under the care and command of Dirk Mahone, it truly begins to beg the question of his involvement within this. What role exactly did Brian Thompson play to be further down within the hierarchy, but sacrificed? Now, I'm going to use that word lightly.
Take it with a grain of salt.
Because again, we don't know the motive behind the incident. We don't know if it was business related or personal related. We don't know if Brian Thompson was on the side of good or the side
of evil.
We don't know if Brian Thompson ruffled some feathers and disagreed with those around him, understanding that he offloaded $15.1 million of his stock shares for United Health Group prior to the DOJ probing, again, insider trading. Could he be pegged as guilty or was he innocent? Is he the canary that was going to sing? Did he pose a threat to those around him? But as more uncovers, I'll be here to cover it. And Andrew Whitty, you're on our radar. Generally, as a society, we need to start looking to take care of each other. As a patient of these physicians, as a beneficiary to these insurers, it is very important to be your own advocate. Never relent, never give up, but always also have a plan. Be an advocate of you and your loved ones. Because the only person that is going to fight for you is going to be you and your family. If not your family, it'll be you. Thank you so much for joining me for my bit of news for today. As you know, my name is Broker Evan Pollard, your independent licensed insurance broker, here to serve you and only you. If you find yourself no longer wanting to be a beneficiary of United Healthcare, you can give me a call today and I will place you exactly where you need to be. Don't know if you have a special enrollment period worried or able to enroll, don't know when you have the ability to make a change, you can give me a call and I will definitely let you know. And with it being the end of the year and going into the beginning of the year, let's just say you have time. If you found this video helpful, please give it a like, comment, and share if you care, and don't forget to subscribe to my channel for more videos. And with that, I will see you guys in the next one.